Hi, I'm Scott Painter. I'm one of the 5th year or chief residents here at University of Illinois College of Medicine in Peoria and our main teaching campus here at OSF Saint Francis Medical Center in Peoria, Illinois. I'm currently standing in one of our newer operating theaters, which we have about 15 of these. In our program, we have about 20 residents total, so about 4 per year during the 5 years of our training. I think one of the big benefits that I've really enjoyed from here is very one-on-one working directly with your attending. A lot of these cases tend to be fairly complex, especially since we don't have any fellows. We tend to participate in some cases that would be considered more fellowship level cases, so that by the time that you're my year, more comfortable with things like thoracics, cardiovascular, things that you usually wouldn't at another facility. We also have very smaller teams, meaning there's only 1 or 2 residents usually a part of each of these services. So you get a lot of opportunities not only work directly with the attendings, but also with these cases, which you start operating in the operating room much sooner than a lot of other universities or places that you could train. Here we're standing in front of the surgical intensive care unit where we have over 30 beds specifically devoted to taking care of surgical and trauma patients. We are a state-affiliated level 1 trauma center, and so we do have a fairly high volume. Numbers a couple years were about 1,800 trauma activations. And this is kind of the main wing that we take care of these surgical and trauma patients. A lot of the time, we do fairly complex reconstruction. So I have found the surgical ICU very beneficial in my learning experience too. We residents, especially during my chief year, I've been given a lot of autonomy or power and just kind of decision making in caring for a lot of these very sick critical patients. We also have a fully staffed surgical ICU with the nurses as well as 4 APNs that will help us with all these. So now we're currently in one of the older OR buildings here in OSF, where honestly probably a majority of the training takes place. Most of our cases, general surgery, thoracics, some of our transplant will occur in these, as well as we have a very robust robotics curriculum where we're very used to using the Da Vinci robot. It's something that we every single year get to work with Johnson & Johnson to be able to have that certification as residents. There's 22 ORs over here. And again, this is where we spend the majority of our time in our general surgery training. And so this is one of the older ORs that we have here that we work in at the Gerlach building. Of that, we do a robotics curriculum here. We have 2 of the newer Da Vinci Xi and 1 of the Da Vinci Si. A part of that too is one of the rooms actually has a simulator that we get to every 6 months make sure that we get to hone in on our skills. You look over here on the side too, it's very helpful because we get to sit side by our attending who will give us direct steps. So at any point in the case, we're able to interrupt and transition and continue on the case with directly under the attending supervision. Thank you for taking the time to check us out as an establishment. I've been very happy here at the University of Illinois College of Medicine at OSF Saint Francis in Peoria.